another one that's really coming out, especially in the population that I've worked the most with, which is pediatric heart disease, is the mental health and the anxiety, the depression, and the post-traumatic stress parents have experienced and how that's influencing their parenting and their coping.
Yeah. Welcome to the Medical Trauma Support Podcast, the show where we shine a light on the hidden impacts of medical trauma, explore tools for healing, and empower you to take control of your health journey. I'm Sarah, your host, a passionate advocate for trauma-informed care, somatic healing, and compassionate conversations. I'll bring you expert insights, healing strategies, and personal stories of resilience to help you feel seen, heard, and supported on your path to recovery. Hello, everyone. Welcome back to the Medical Trauma Support Podcast. I have Dawn Ilardi with me, and Dawn is a psychologist who works in the medical space. And Dawn, I'm going to let you share more about yourself and a little bit about what brought you into this space.
Thank you, Sarah, so much for having me here. Medical trauma is something I'm extremely passionate about, and it's been a small sliver in the background in a lot of my career, and I'm having more opportunities to grow this. So I really appreciate this space to talk. So I have a specialization in neuropsychology as a psychologist, and that just means I've really spent the early part of my training understanding how diseases and disorders and illnesses affect the health of the child's brain and what we can do to support these kids. And as you can imagine, along the course of this, these children are having a lot of exposure with, to medical providers or surgeries, and their families are helping their kids through this journey. I was in the pediatric healthcare setting for 16 years and then started a private practice. And one of the main reasons I left healthcare was because I saw that the pediatric system just can't support parents. Parents are not the identified patient. Their focus is on the child. And some really resourceful, amazing hospitals around this country and beyond do have other ways, creative ways from donor funds and grants and to support parents. And sometimes they have allied professionals like chaplaincy or social work to support parents. But oftentimes I felt like when they were in my office, I wanted to spend so much more time just talking to the parent and leading them and guiding them.
Yeah.
Obviously in the context of the child too. So this has just led me to this new space to be able to think more creatively about what I can do with parents.
Yeah. I think that's so beautiful because I agree so much with what you're doing and the impact that parents have. We know that the impact parents have on kids is massive. But one of the things is when our kids are going through something hard, like you said, often the parents aren't thought about, and the parents are going through it along with the child. They may not be experiencing the physical pain and challenges that the child is, but it is excruciating, terrifying, all the things, right, for
Yes.
a parent when their kid is going through a medical experience. And the parent, how the parent is caring for themselves and how the parent is feeling and how they engage with their child has such a massive impact on the kid's experience.
Absolutely. And that's where the research is taking us now. So I'm also a clinical scientist too. I've done a lot of research over the years. And one of the things that the research teams that I've worked within have focused on is protective factors and risk factors in childhood outcomes. And repeatedly, the same pattern shows up, which is that parents have to change outcomes. And sometimes there are simple variables like parent education or parent income, which is a proxy for so many other things, one of which is certainly access to resources. But another one that's really coming out, especially in the population that I've worked the most with, which is pediatric heart disease, is the mental health and the anxiety, the depression, and the post-traumatic stress that parents have experienced and how that's influencing their parenting and their coping.
Yeah.
So Absolutely. These parent outcomes are modifiable and they are a driving factor for how children are coping, building resilience, distress tolerance,
Yeah.
and potentially long term being able to engage with the medical system in a way that's going to help if they have a chronic medical condition.
Right. And I want to go back to what you said about the power that parents have. Because, sometimes it can be easy for us, especially as a parent with my own trauma history, as I'm bringing my child into the system, which is what brought me into this medical trauma space. It's so easy for us to feel like, oh my gosh, I did that wrong. I messed up. I did this. I want to take that and actually say, first of all, you're human. You're doing the best that you can. So congratulations on that. Don't beat yourself up. And I would like people to kind of flip the narrative to less about I've messed up because I came in and I wasn't regulated. And I want to flip it to parents, you have so much power to make change and to show up for your kids in this moment. Once you learn this information,
Mhm.
you can make a difference, even if you weren't perfect before, because there is no one that is perfect. There is no perfect parent. You can take the information that Dawn you're sharing today
Mhm.
and start to shift what you're
Mhm.
doing and how you're showing up for your kid. And one of the things that you talk about, Dawn, that I love so much is about helping you help parents take care of themselves first
Mhm.
as your first step.
Yes.
And will you talk more about that?
Yeah, and I just want to expand on what you just said. It's never too late to
Yeah.
change the course of something. It's never too late. And these symptoms associated with medical trauma, wherever you're at, they're treatable and they can be reduced with
Yes.
new strategies and changing your course. So I just want to emphasize what you just said. Taking care of yourself, it's a very it's a big statement,
Mhm.
and it really has to start with very small steps.
Yes.
And the first thing is just recognizing how important you are in the
Yes.
equation with your child. That your child feels everything you feel,
Mhm.
that whether it's subtle facial expressions or the way you're interacting with your touch or your body to the way you interact and talk. So it's these subtle things. So, first, it's just recognizing that you have the power within your dynamic with your child and then paying attention. What is it that I am feeling? What do I need to pay attention to about myself?
Mhm.
So it starts with these really simple things, recognizing these things. And depending on the parent, whether we're talking about everyday interactions or long term self care,
Mhm.
it can be the little things while you're in the hospital, like taking the 15-minute shower instead of the 2-minute shower so
Mhm.
that you can breathe and cry.
Yeah.
Or go get coffee 3 times a day instead of 1 if you need to walk and breathe and get out of the hospital room. It's okay to feel like you're gonna annoy the staff and bring 5 pillows and 10 photos and 7 coloring books and 3 stuffed animals to contextualize that hospital room. So sometimes it's these little detailed things.
I love that because you're right. The phrase "take care of yourself." It sounds like it's all on you. This is yet another thing that to put on your plate, but it's like little kind acts that you do for yourself that maybe just take an extra minute or an extra 5 minutes, or like you
Mhm.
said, take the longer shower so you can let some of the fear and the sadness and all of it come out. Sometimes the rage, right? Like, why is this happening to my kids? This is not fair. But to have like a little bit of time for yourself that you can do that. Another thing that I will talk to people about is doing little like somatic things for your body. So one very simple thing to do is to give yourself a hug. So if people are listening now and you have a minute and you don't have your hands on the wheel of your car, just take your hands and put them on your shoulders and just give yourself a hug. If you have more time, you can do a little bit of rocking side to side. Something just that simple, just to give yourself a little bit of love.
Yeah, these things, sometimes when you're so activated,
Yeah.
It can be harder to remember to do these things. And sometimes, Sarah, and you tell me what you think, but sometimes I'll encourage parents to almost make these little things part of their daily practice. So I've
Mhm.
talked about the sighing, which
Yeah.
you did when you were hugging yourself. And I'll say it's totally fine if you annoy people, whether you're in the grocery store, they're going to think you're probably annoyed because you're sighing,
Yeah.
but starting to integrate them into the quiet, more calm moments, because then when you're really activated, some of these things might be just slightly more familiar to you.
Yes. I will share a story that I have shared multiple times with people because it was so impactful for me. But one of my teachers, one of my nervous system teachers and guides, she describes it as a hurricane, right? So we want to take action before the hurricane picks up, right? We want to, when we just start to feel that breeze, right? And so when you start to feel that breeze is when we start to go, oh, I'm noticing this shift. And this takes some practice and time, but oh, I'm noticing this shift. And this is when I'm going to take the time to do a deep breath or give myself a hug, or if you can, go for a 5-minute walk outside. And these are, if you can, it obviously depends on the situation you're in. But it it really made me think of what you were saying, John, of like, let's do these practices before the hurricane is at its strongest, before the hurricane is raining down, blowing the shutters off. Let's do these practices. Let's get our body used to it because there are practices I do now, nervous system regulating practices, that all it takes is about 10 seconds of me starting
Mm.
my straw breath and my tapping, and my system now is like trained to like, we're safe. We're safe. Okay. And so I think doing those practices regularly when it's not the full strength hurricane going on makes it easier to use them and remember to use them. And your body is more responsive when things are really hard and really, really challenging.
I absolutely agree. Sarah, one thing I wanted to mention because I was curious about your thoughts on this. So recently, I was talking to some adults who grew up with heart disease and they'd had many invasive procedures
Mm,
and readily endorse their medical trauma now. And one of them told me very clearly that when she first got into therapy, she could not do the somatic exercises
mhm.
because it was so uncomfortable to pay
Yes.
attention to her body. It was really activating and triggering. And it reminded me that disassociation becomes a very powerful strategy for
Yes.
some kids and teens and adults too. So
Yeah.
they can tolerate the pain and
Yes.
so they learn to ignore their body because it becomes a functional strategy in that at that time. So tell me, how do you talk to individuals who want to do somatic exercises, but they can't or they're afraid? It's so uncomfortable. How do you talk to them?
So, first of all, I saw a perfect video, I think, that describes this. And it was a drone with a head. Someone had like put like a paper mache head on a drone.
Mhm.
And it was like trying to talk to your clients about where they feel something in their body. And it was like, there is no body, there's only a head. And of course, hundreds of thousands of people liked this video because we can relate to it.
Mhm.
We can all relate in some ways. Yes, it is incredibly common when we have experienced pain, trauma, not only medical trauma, but other forms of trauma. It is incredibly common for us to pretty much dissociate from our body. And some people may have parts of their bodies that they've dissociated from. I believe that the somatic work is work that is done very slowly and very gently. And I
Mm.
believe that when people aren't trauma informed and they don't understand that, there may be somebody who tries to jump in too quickly. And I think that that can be re traumatizing. I think dissociation is such a beautiful coping technique for so many people. And it's not a bad thing. Dissociation is not a bad thing. I think it starts to get challenging when you are out of the acute, like kind of the crisis situation, and you want to be more in life. You want to be able to feel more because when we dissociate from the pain, we also are cutting down our capacity to feel the joy in our body as well. And so that's one of the reasons that I start with nervous system education. Because I think when we educate people about what's going on in the nervous system, they
Mhm.
start to feel their agency and their autonomy and just gently start to build little pockets of safety.
Mhm.
And I think we need to have some safety, and it's not always inside of us. I want to be clear that sometimes the first place we find safety is with someone else. But as we start to feel safety, we get a little bit of confidence is the wrong word, but we're able to just dip a toe in
Mhm.
to the somatic work.
Mhm.
And so that was a very long winded response to your question. But the quick response is if you are having a hard time with somatic work and it feels like way too scary to even contemplate paying attention to anything going on, you're not alone in that. There is nothing wrong with you. Your body is doing that has been doing that to protect you. So it's actually this beautiful thing that our nervous systems can do. And very similar to what you said earlier, Dawn, is we can change. Like we can change that. We can slowly and
Yeah.
gently make change and start to heal.
Mhm. Yeah. Yes, and you even mentioned how sometimes we rely on others for that co-regulation,
Yes.
and I would just love to emphasize too that social connection is
Mhm.
critical
Yes.
to self-care and healing, and oftentimes the relationships that in our circles, each of those relationships might serve a slightly different
Hmm.
purpose in our journey in life. And
Yeah.
so all of the people in our inner circles may not be the best person to bring into this space for self-care or for
Yes.
healing. And so I've had many conversations with parents about who is it that you can talk to? Who
Mhm.
is it that sees you? Parents will commonly say, oftentimes in the context of the child, but I believe it's really about them. They'll say, how do I answer these questions? Or how do I get them to understand? And one of the things I encourage them to do is think about what you need.
Mhm.
So, as an example, when a child has a new diagnosis and the parent is afraid to talk about the diagnosis with family because it can be triggering for one
Mhm.
reason or another, they'll say, "How do I talk about it?" And I'll say, "Well, first, what do you want them to do when you talk to them? Do you want them to just listen? Do you want them to problem solve with you? Do you want them to just sit quiet, and support you? Then,
Mhm.
do you want them to let you cry?"
Mhm.
So you can share with them all that you've learned, but I think it's also a good idea to tell them what you want, what you need. And another
Yes.
way to self-care, right, is to
Right.
say, for example, if I was talking to grandpa because he takes care of my son every week and I tell grandpa and grandpa's triggering for me, I could say, "Dad, I'm going to tell you something and I need you to just listen. I'm not ready for your opinion. I just need you to listen."
Yeah.
This is- this social connection is a huge part of self-care.
Yes, yes, I am all about social connection. It's literally why I started the community that I have, the Befriend Your
Yeah.
Body community, because social connection is so crucial to us as humans. And when we're going through something hard, and we may have our community that we have may not really understand it. They don't understand what we're going through. And so to be able to come into a group, the community is full of really kind, compassionate people, and to be able to show up in the peer support group that we have and to have people say, yes, oh my gosh, that must have been so hard. And they've experienced similar hard situations. It's just, there's something so incredibly soothing about it. It's
Mhm.
really validating. So, to add on to your and onto your talk about community, I think sometimes there are going to be people in your life who love you and you love, and they do not have the capacity to sit with you while
Mhm.
you cry. They just can't. But you know what? They make a wonderful meal and they would love to drop that meal off at your house.
Yeah.
And so that's to go back to what you said about think about what you need and what you want to ask somebody for. The people who you think have shown that they have some capacity to be with you in hard times, they may be the one that you call and you say, would you be okay just coming to sit with me and listening to me? And I might cry. So I want to let you know that in advance. And what I'm really looking for is for you to be with me. And then this other person who you know doesn't have the capacity is the person that you're like, you know what? What I would really love is if you could bring a meal and maybe even wash the dishes, right?
Yes,
So,
yes.
yeah, we recognize that not everybody in our community has a capacity to sit with the emotional things, and that's
Mhm,
okay, right? It can be really hard if you don't have anyone in your community that can sit with the emotional things, but to really like see that people do want to show up, but they can't always show up exactly how you want. So think about your experience with them and like this person is a meal person. This person is a let's go for a walk person.
mhm,
This person is the one that I can call at 2 a.m. and cry. So you build that community and there are other resources as well, like my community. There are a lot of support groups at hospitals. There are post-intensive care syndrome support groups, PIC support groups. John, you probably know about a lot of support groups for parents. So these are the times when we're going through this really hard stuff where we don't really feel like we have the bandwidth to reach out and create new community. But if you find communities of people who really get it and
mhm.
understand what it's like to be in these medical environments and medical situations and the emotions that come along with it, they're a little bit easier to step into.
Yes, and one thing that may not be so obvious, depending on where you're at in your journey, is that part of the way we can regulate better is when we have the space to feel things and we're validated.
Yes.
Parents will often ask me, again, because oftentimes I'm caring for parents through their child.
Mhm.
They'll ask me how to help their child with things like self regulation
Yeah.
or resilience. And it's really easy to assume that regulation starts with an action,
Mm,
with breathing
mm,
or grounding. But in my experience, my clinical experience, regulation first starts with creating space and room and realizing that whatever you feel is valid.
mhm.
And
Yeah.
that's part of what happens with that social connection is
Mm,
it becomes an intentional space where the person can feel and sit with people who have similar lived experience or just understand your pain.
yes.
I really think that's the first stage of learning to regulate
Yeah.
and tolerate what that feels like is
Yeah.
to sit in it.
Mhm.
And then and for that reason, I'll tell parents, when you're sitting with your child and your child is really upset about something, they
Mhm.
don't need you to fix it.
Mhm.
They need you to accept
Yeah.
and then help them believe they can handle it,
Yes.
which is also going to be y- more powerful a message you give your child if you can sit in the space where you believe your child can handle it.
Mhm.
Your child is having a temper tantrum because they have a needle phobia and they have to go to the doctor the next day.
Yeah.
And you're sitting on the bed next to them and you have your own medical fears and you're scared because
Yeah.
your child is scared. But deep down, the needle's not gonna, it's gonna hurt, but it's not gonna be dangerous. So if you can find the space to sit and feel your child's pain and tell them it's okay and it's normal
Mhm.
and you can handle it, it's gonna hurt, but you can handle it.
Yeah. Yeah, and I think like you said, to be honest, right? Yes, it will hurt, right? It hurts when a needle goes into your body. And I'm going to be right here with you, just like I
Mhm.
am right now. I am right here with you. And maybe if
Yeah.
there's going to be a procedure where you can't be right with your kid, you can also talk to them about the helpers and how the
Yeah.
medical professionals are there to help them and there to keep them safe. Yes, that capacity to sit and be with somebody, and I call it holding space, right? That
Yeah.
capacity to sit and hold space with somebody. A lot of us were not taught that,
I know.
and so, I think for people listening, I want them to know that it's not an easy thing. So we're talking about it. This is not an easy thing to do, and it is
Mhm.
an uncomfortable thing to do oftentimes.
Very.
So as the parent to be able to sit there and acknowledge the discomfort that is in you is
Mhm.
so important. Do your little regulating practices, whatever it is. Maybe it's breathing, maybe it's, you know, feeling your fingers, maybe it's counting your fingers, whatever you need to do to be in a space where you can sit and be with your kid. I think a lot of times we try to use words. Usually in these moments, our presence, our quiet, still presence is what people really need, because when somebody's scared, words are not they're not getting in like they normally would. So this is where things like depending on your kid's age and your comfort and level with touch with your children, for maybe a teenager it's a hand on the back so they know you're there, they can feel that warm grounded touch.
Mhm.
For a younger kid, it may be holding them, rocking them as they cry, letting them know you're there. Just being with them is so huge. And it's not easy, but both can be true at the
Yeah.
same time.
Yeah.
And it will get easier. The more you do it, the more it just becomes what you do. And you're just kind of, checking in with yourself. Okay, all right, I've got this. And then your kid goes to bed, and then you go into your room and you can sit and cry
Exactly.
if you need to, or
Exactly.
go get in the shower and cry. And I have personal experience of, my first child in the first 2 years, we had medical experiences that were scary, painful for my child, very emotionally painful for us to witness. And then years later, with my third child, they were going for a procedure that was a tiny procedure, but they were going to be put under general anesthesia. My body responded as though my child was going to die.
Wow.
Medicine, my body had a massive response. And what I realized is that there was a lot that I was still holding on to from my fears of my first child, that I was afraid that my first child would die. And so that meant that I had some work to do,
Yeah.
and not work with my child, work in my own therapy.
Mhm.
But because I'd done this work and I'd been in therapy so long, I was also able to do a lot of the work on my own in my room after my children were in bed, where I would feel the feelings and I would sob and I would journal and I would talk to my husband about it, so that when we showed up for my child's very, very minor surgery, I was in a much better place.
Wow.
And by the way, I had a plan written out, had my plan written out. So once my child went into the back and I was no longer able to be with her, and I
Mm.
knew it wouldn't be a long surgery, I stepped right outside and I was circling the building. I knew what my body needed, and that was to move, because sympathetic charge is a very fight or flight is my body knows well, let's just say it that way.
Yeah.
And so I knew that I needed to move. So I had my plan. So I did my prep work by processing a lot of things that were coming up and old things that were coming up.
Mhm.
And then I had my plan for how I was going to take care of myself, so that when my daughter came out of the procedure, I was grounded and I was ready. And I just quietly got into the bed with her and I just held her.
Wow. That's beautiful.
Yeah.
What an example.
Yeah.
And that makes me think about really good strategies for parents to making the before, during, and after explicit.
Yes.
If you're going through things with your kid or yourself, but really being intentional and planning, what do I need to do in advance of
Yes.
this triggering event?
Mhm.
And slowing down and planning is so hard, but I think it's hard for reasons that are related to the anxiety. It's not really the slowing down and doing it, because I know it's so important to parents. I think it's easier to avoid it because it feels overwhelming.
Yes.
But, as a small example, calling and finding out details in advance from your medical team.
Yeah.
Where are we going to be? And when am I going to be separated from my child? How
Mhm.
long is it going to take? Or just looking at pictures and videos in advance with the child, packing your self care, your calming kit. making
Yeah.
a list of self-care activities, et cetera, et cetera. But these kinds of before, during, and after are other great ways for parents to self-care and to be active in their child's healing through
Yes.
the hospitalization or surgery procedure as well.
Yes. And again, to go back to what you said about the power that parents
Yeah.
have,
Yeah.
it is a gift that
Mhm.
we have the capacity or the ability to have such a big impact on our kids and
Mhm.
such a positive impact on our kids when we can show up with them and be with them.
Yes.
I just really want people listening to leave with that message, right? That
Mhm.
you do have so much power over the experience that your child has. And I don't want to sometimes I feel like when we say that it can add some extra stress, but it's really your presence
Yes. Yep.
that matters.
And Sarah, there's been some growing research about the importance of the parent's presence in the hospital
Yes.
setting. And one of the variables that they have found is related to traumatic symptoms in parents
Mhm,
is when they don't feel like they have a role.
mhm,
And I can only imagine what that feels like because it's intuitive, it's biological. We know it oftentimes innately what we're supposed to do to be a parent. Maybe not
mhm,
all the time, but it is this natural thing to know what we're supposed to do to care for a child. But when we go into the hospital and there's a lot of medical providers and they're taking over some of those things,
mhm,
or your
mhm.
child is really fragile and you're afraid to touch, or even if it's an infant, to snuggle because they're attached to tubes and wires. So parents lose their role.
Mhm.
And so I've started making this a more explicit conversation with parents, and they'll openly say things like, I felt like I was going to do it wrong, or I felt like I was going to
Mm,
hurt my child, or I didn't know what to do. And so taking back that role in any small way you can is
mhm.
another way to influence your child in a positive way. And it could be just by having a conversation with the nurse because you don't even know what to do. You can say,
Right.
what can I do to take care of my child's, wound care
Mm,
or toileting needs or showering or a physical therapy? How can I help with these stretching exercises while you're not here?
mhm.
Any little question, because then you're taking part in that decontextualized setting that is, it's reducing where you have this hugely important role
Yes. Yeah, and purpose.
and purpose. That's a great word.
Like, we're humans. When we have a sense of purpose, it just makes life more manageable, right? It
Mhm.
makes the challenging things that we experience as humans more manageable to feel a sense of purpose and to feel needed and
Mhm.
important, right? And especially when it comes to your child.
Yeah.
Yeah.
Yes. Yes.
That really also, leads me into something else that I know that you help parents with, Dawn, and that is to help parents understand what are some of the age specific needs
Mhm.
that kids have because as you have shared with me before, sometimes parents can forget that their children are responding actually in appropriate ways for their age, their trauma histories, their where they're at in their whether they're neurodivergent. There are so many different
Mhm.
factors. And I would love for you to talk more about how you work with parents to help them understand a little bit more about kind of normal responses to some of these really challenging medical experiences.
So, a lot of my work with parents does revolve around an evaluation for the child,
Mhm,
neuropsychological evaluation. And so I'm trying to
mhm,
understand their cognitive academic, social, emotional, behavioral strengths and weaknesses or symptoms. And kids are so complicated because the same underlying message they're trying to send us can show up in different ways. So we'll take anxiety or fear as an example. Anxiety and fear looks different depending on the age of the child, whether or not they have a neurodevelopmental disorder.
Mhm.
So if a child with autism, for example, is fearful, what we might see is an increase in stimming behaviors or repetitive behaviors as a way for the child to regulate. Or there could be increased rigidity or inflexibility or getting stuck because they're wanting to really master and control and get a sense of feeling safe.
Mhm.
A child with ADHD could show behavior problems, some acting out behaviors because they're afraid.
Yeah.
And sometimes these behaviors get misinterpreted. And
Mhm.
especially in the context of a parent who's overwhelmed, who's
Mhm.
having trouble seeing their child
Yeah.
because they have their own anxiety or trauma.
Yeah, or just absolute fear about the
Mhm.
situation and fear of their child being hurt or losing their child. And when you think about the nervous system, it wouldn't be uncommon for somebody to be shifted into this is very dangerous, right? Because it is. It's like danger, danger. There's
Mhm.
something going on with my kid. And we know that when we get into that sympathetic charge and it feels like there's danger, that we are more likely to be really irritable.
Mhm.
We're more likely to see people in a more negative light, like, oh,
Mhm.
they're trying to upset me, or, whatever
Yes.
phrase it is that somebody might be thinking about in that moment.
Yes. Yes, absolutely. Yes, and what I'll hear oftentimes is with aggression that occurs during a medical procedure, it's seen as a behavior problem.
Mm.
And the way, unfortunately, sometimes it's handled is with something like restraint. And depending on where the parent is at in this moment, sometimes that restraint ends up being handled by the medical team. And if we could plan in advance and we really understood how a child was going to show fear, which would
Right.
be, with we have this fight, flight, or freeze response. This is the fight response. This
Yes.
child is terrified and
Which makes
restraining.
sense. It
It
makes
does.
sense.
When
Yeah.
you step back and you have the moment to reflect, in the moment, it can be terrifying. You don't know what to do, and the medical team is telling you, "We have to get this done." But when we can plan and we can really understand a child, we can think about how to handle these things in advance.
Mhm.
And medical teams, they mean well. And
Yeah.
sometimes they themselves don't understand what the behaviors are conveying. And so parents need to educate. Parents
Yes.
need to tell the team what the triggers are and how my child responds when he or she is scared, for example.
Yes, and one other thing I wanna add is I don't know if you're familiar with the butterfly pig. Mary
No.
Jenner she's amazing, she's a nurse, and sh when she was a nurse, she was showing kids with, like, their teddy bears or different things, like, some of the things that were going to happen, right? To really letting them know, like, "And this is what this looks like, and this is what it will be like." And she has created a business where she is now creating toys that are little replicas of the different things that are used, like a little MRI machine or a
Oh,
little
wow.
kidney dialysis machine. It's really amazing. Something that she said that I want to bring in here is she talks about the pause,
About the
the
pause?
pause,
Okay.
like just taking a pause.
Yes. Yes.
As the parent, asking for just a pause, like, can we just pause for a minute? Because a lot of times you can. Things are not always an emergency where it has to
Yes.
happen that second. A lot of times you can say, can we all just take a pause?
Mhm.
And then everybody's able to pause. The medical providers can take a minute to gather themselves. The parents can take a minute. The child can take a minute.
Yeah.
If you have some breathing techniques you can do it with your kid. You can take a minute just to hold your kid. Just say, "Oh my gosh, this is feeling really scary to you." And just taking that pause. And so it just brings everything down a notch and it gets people out of their survival brain.
Mhm. Mhm.
Must do this thing now.
Mhm.
To, oh, wait, that's right. This is a child. This is a person. Here are their parents. They're having a hard time. what can we do differently? Maybe there's something we can do differently that's not going to seem as terrifying to the child. Maybe this is a moment after the pause where the parents can say, we have this thing we do at home that really helps calm our child, or something as, and I wish I had it with me, I did have it sitting out on my desk, or even in the case of a needle and a needle phobia, there's a cold spray you can do, there's a
Yes.
fuzzy
Yes.
bee you can use, there's something that we got at our pediatrician's office, it's shaped like a U and it has little spikes, not that go into your body, but that you kind of press into the skin so that the needle isn't really registered
Right.
as much because there's already some input around the skin. So there may be things in that pause when everybody's able to like just settle and get back their ability to think, right? Things that can make the experience more manageable for the child. And maybe the child doesn't have to dissociate.
Yeah.
Like, to go back to what we were talking about
Yes.
dissociation is in those situations, oftentimes dissociation is the kindest thing that the child's nervous system can do for
Yeah.
themselves, right?
Yeah.
But maybe we can take the pause and everyone can settle and we can find a way to do this thing that is feels safe enough to where the
Mhm.
child is able to stay and isn't doesn't have to use the coping technique of dissociation.
Yeah. Yes, and for any listeners who think to themselves, "Well, how would I do that?" Um, in the moment when you're standing there with the doctor and you know the doctor's rushed, I want
Mm,
to give you permission because having
mm,
been in the healthcare institution for so long,
mhm,
there's, there are some different social norms that happen
mm,
between a patient and a doctor, a patient and nurse, patient healthcare provider, right?
mhm,
And there is this sort of implicit sort of hierarchy that I think a lot of parents feel like they're supposed to do the right thing. They're supposed to be a good patient, a good
mm,
mom, that they don't want to get in the way. They don't want to bother the doctor or the nurse, et cetera, et cetera. And they may also feel rushed
mm.
because they sense that the provider is indeed in a hurry.
Yeah.
And I would just like to make it explicit to any parents that are listening that while some of these things may be the truth of how the medical or healthcare setting can feel uncomfortable and it can add to the layers of anxiety and feelings of not having control with our child, you still have every reason to advocate for your child. If
Mhm.
that provider is in a rush and seems to be very stressed, they may be, but
Right.
just remember that that's normal for the system and you can still advocate. You can still say, I think my son needs a pause. Let
Yeah.
me breathe with him, et cetera, et cetera.
Yes. And how powerful, because you know what? I won't go into too many more stories because I've already shared a few, but I saw a shift in a medical provider in not even a month ago,
Mhm.
with one of my children. And my children was advocating for themselves. She was able to advocate and say, "Oh no, I'm not okay with that. I told you to stop doing that. That
Wow.
hurt," which was amazing, right? But what happened is I saw a shift in kind of like this medical provider of, "Oh, we always do it this way for this reason, but oh, I guess we don't." And then she applied it to her own experience as the mother of a child who had experienced some dental trauma.
Wow.
So asking for the pause, while it will help you and your child, it may actually start to make shifts in the way that the medical providers see things. And it could make a bigger change than you really realize just by asking for that pause.
100% agree.
Yeah.
Many healthcare providers, they are healers. They want to
Yes.
do everything they're supposed to do. They want to nurture. They're competing with so many pressures that don't relate to what's happening in that little
Yes.
room. And when you feel this stuff going on, it is absolutely the right thing to do to advocate, to call for the pause, because you'll remind that provider in all the pressures they feel, oh, yes, I have to be present here.
Yeah.
And I agree, you could make the entire change for the day for that provider.
Yes. If every one of us were to come in and just use this even the power of the pause, right? Can we just take a pause? I mean, the ripple effects can be huge. They
Mhm.
really can. We can together make some change in the system just by asking for what we need and what our kids need.
Yes. Yep. And it is slowly happening.
Mhm.
Conversations are shifting. It will be the case for some time where some systems are just better at understanding kind of the some variation of trauma informed care, but the conversation is shifting. Things like medical trauma are becoming more mainstream conversations, more acceptable to talk about. And it's definitely making its way into research for outcomes. And I think that's part of what drives change
Mhm.
is medical providers need to see numbers and
Mhm.
they need to see where the data drives a decision towards change, such as,
Mhm.
a model that is informing their care.
Yeah, that and what we talked about, right? Both together, if they're getting at both and like the research and seeing the data and the
Yes.
human piece too, right? The human piece of the people showing up in the room advocating for the
Mhm.
pause and for more human focused care.
Mhm.
And it's hard, I want to acknowledge that it's a system that is hard on everyone. It is hard on the medical providers. And sometimes they have what, 7 minutes, whatever, a very short amount of time. But somebody who's also under that kind of stress could also use the pause.
Yes.
The pause doesn't have to be a 20-minute pause. It can just be like a pause, like, oh wait, let's regroup.
Yeah,
Let's take a minute and just remember we're all humans in this space, right?
absolutely.
Yeah. Well, I am wondering too, Dawn, about the population that you've worked with. I know you've been in this field for a while, working with families, working with kids who are now adults, and how you've noticed that some people are acknowledging, wow, this is medical trauma,
Mhm,
but there are a lot of people that aren't. And this is also my experience of people who have nightmares or who are dissociating regularly or when they're asked by their therapist to like, where do you feel that in their body, have no clue where they feel it in their body.
mhm,
you know the, you're talking to people kind of in this whole spectrum.
mhm.
um I would love it if you would just talk a little bit more about that.
You know, I think that a couple things. First, medical trauma is often equated automatically, probably because of the word trauma, with PTSD or post traumatic
Mhm.
stress disorder, post traumatic stress
Yes.
symptoms. And I hear this even from psychologists who just don't really completely understand how medical trauma can manifest, such as, for example, maybe it manifests as in a young adult depression and avoidance of the medical system. That
Yes.
would be a little harder to recognize the links than
Mhm.
it would somebody who is fearful of very specific things or gets triggered by something associated with the original trauma.
Yes.
And so, how this is coming up now is in some of the adults I'm talking to who have congenital heart disease. So, they grew up requiring open heart surgeries or having lots
Mhm.
of procedures, maybe associated with another medical condition too, is they're discovering in their adult life through conversations with others who have either been through therapy and learned this about themselves. They're then self diagnosing and they're now going backwards and connecting dots.
Yeah.
Um, or they didn't realize that this was something that could be treated. It was the discomfort they lived with and that it was associated with these early experiences. And Sarah, that's where I sit in this really funny space because I've seen people longitudinally. One of my questions that I would love to find a way to answer is how do we use what we know from adults and parents now who can reflect back to
Mhm.
what is going on in the pediatric population so that we can change the course?
Right.
How can we use the adults who have a history of medical trauma and the parents as well? How can we inform the parents who are living it now?
Yeah, and if I understand what you're saying correctly, talking to the adults who were once the children
Yeah.
experiencing the medical procedures. And it's really interesting. The podcast episode that I just released, like less than a week ago,
Yeah.
was speaking to an adult who was a child that experienced medical trauma throughout most of their childhood. She went to school and she got her master's in social work. And during that time, she wrote her thesis on childhood medical trauma. She had a qualitative study and she spoke to adults who had also experienced childhood medical trauma and really kind of across the board, different medical experiences. And she found some of the experiences that were the same across the board. And I
Wow.
have put it on my website under resources
Hmm.
for anybody who wants to read it. She talks also a lot about how the ACEs, the Adverse Childhood
Hmm.
Experiences questionnaire, does not include medical trauma, which
Yes.
is
Yes.
incredibly bizarre.
Hmm.
But I think it goes along with probably both of our experiences of a lot of people not thinking about
Hmm.
medical experiences being traumatizing.
Hmm.
So the conversation with her was hard because of the content, right? She was talking about these experiences the children had and how it felt to them
Yeah.
and the mental health impact and the suicidal ideation
Yeah.
that more than one of them had as children. And so that's why it was hard, right? It was a hard conversation because of the real stories. But I think it was really an important one because we are listening to the people that have experienced it and the things that happened that hurt and the things that they wish that they had had and the things that we can do now. And one of those things is for clinicians to understand that medical trauma is just as impactful as childhood abuse.
Yeah.
Right? And I
Yeah.
know that
Yeah.
sounds, oh, just saying that sounds really almost harsh in a way, but actually medical experiences, they can be painful. You talked about restraint earlier. If we as adults can even put ourselves in that position of,
Hmm.
and some adults have experienced this, I want to acknowledge that, but of being restrained, of experiencing pain, of feeling betrayed because depending on the age of the child, sometimes it is their parents participating in the restraint
Yes.
or their parents standing by and watching
Yeah.
them being restrained and then feeling pain.
Yes.
And to go back to what you said earlier about the child's age and their developmental level, at an early age, they can't necessarily understand unless we are very explicit about it and do a lot of preparing before and during and after. They may feel incredibly betrayed and not understand that the medical professionals are actually trying to help them. It can feel like the medical professionals are trying to hurt them and their parents are complicit in it.
Yeah. Yes, and another layer beyond just the cognitive part is, many of us in this arena know the book "The Body Keeps the Score," and
Yeah.
I think about that all the time with the congenital heart disease population that requires infant and
Yes.
early childhood surgeries.
Yeah.
And related to what you just described, oftentimes what I wonder is if their dysregulated nervous system started very early on because of, extremely painful procedures, invasive
Yes.
procedures and medications and sometimes other medical things that are different about their body. And so they grow up with this abnormal nervous system. And the way I see that manifesting, we know that there's a higher rate of neurodevelopmental disorders, for example, with
Yes.
congenital heart disease, the population I work with the most. And oftentimes we attribute it directly to the brain. And we say because these kids have high rates of strokes or because
Mm.
their circulation isn't as good to their brain. But I truly believe, and nobody has looked at this yet, I truly believe that part of it is related to the nervous system and
Yes.
what the peripheral nervous system has experienced with
Mhm.
these pain and these invasive procedures. If you have an overactive nervous system, you are probably going to have attention problems. And
Yes.
you are probably going to have a high startle response and you're probably going to be a little bit anxious and easily overstimulated with various different stimuli. And so we end up, diagnosing these kids with ADHD or, s- at high rates of anxiety, et cetera. Not to say the diagnosis is wrong, is just to say that what can we be doing? How can we go backwards if we know this stuff is happening later and we know there's repeated medical trauma? And by trauma, I just mean it's a matter of fact.
Right.
3 open heart surgeries, 5 caths, and a
Yes.
transplant. This is trauma. What can
Yes.
we do?
Yes. I think there are a lot of things we can do. There are things that the system can do, and there are a lot of things the parents can do. Again, the power of the parents. As you know, and anyone who's listened to this podcast before, there is so much we can do with nervous system education, with somatic practices. The mental health piece is such a huge part. It's hard for me to even understand how it's been separated, but we know that mental health and physical health are
Yes.
intertwined. And so it needs to be seen as just as important in medical settings. And I think that is a huge step in the right direction. But I do also think that support for the parents and the kids is hugely important.
Mhm.
One of the reasons is because then it helps the nervous system. So I do think there are absolutely things that we can do to minimize the medical trauma. We can't always prevent it, like you said. When
Mhm.
somebody has gone through these really hard, painful experiences, life-changing experiences, there's typically going to be some trauma right
Yeah.
from
Yep.
that.
Yep.
And we can heal. And I do fully
Right.
believe that we can heal from that. I know you and I are on the same page with this because of our conversations, and I love so much the work that you've done and that you're doing. And as we wrap up this episode, which I wish that I could talk to you for like 5 hours about
Me
this.
too, Sarah. Me too.
We could we could write it all down and get very specific about these changes that we know would make a big difference in kids' lives and the parents' lives, of course. I really like to, at the end of each episode, have my guest leave a nugget of information.
Mm.
And I would love it if you have something that you would like people to hear, something that is really important for people to hear on this topic.
Um, I think probably where I would lean into is our emphasis on social connection and finding your village. I just can't imagine what it would feel like decades ago before we had, for example, telehealth and social media and virtual opportunities to connect because now um, it's so easy.
Yes.
That's the one thing I would emphasize is continuing your search to find the place where you feel validated, you feel like you belong, you feel like you can grow, you can pick up exactly where you are in your journey,
Yeah.
and you can get to a place where you feel more like the woman, the man, the husband, the mother, the father, the daughter, the people you strive to be. And I think the start is finding your village.
Yes. Oh my gosh. Yes. 100%. I agree with you. And I want to say for some people where it's hard for them to do kind things for themselves, right? For some of us, it's hard for us to put ourselves first. I'll give you this little thing you can think about. When you get support,
Hmm.
you are better able to show up with your child and with
Yeah.
the people in your life that you love. Even if you don't do it for yourself, which hopefully you will learn to do that. Even if you can't do it for yourself right now, do it for the other people in your life. Do it for your child who is going through the hard medical experiences because you're going to get the support and also education. Like you're going to learn things that other parents are doing or other people are doing to help themselves
Hmm.
or their kids. So I think that is one of the absolute most key things that we can do is to to find support. That's really beautiful. And Dawn, I also am hoping that you will share with the audience some of the things that you're working on and how
Mm.
they might be able to get in contact with you or at least see some of what work.
Sure. So because I'm a neuropsychologist, in many ways I'm quite general in the kinds of kids and families that I support. But related to what we've talked about here today, I'm in the process of developing an online program for parents of kids who have heart disease. And the reason I'm doing this is I'm trying to close the gap between what we're learning from research and what parents can do to support their kids.
Mhm.
And this absolutely includes this area of anxiety and trauma that I see so often in parents and kids. But what I'm trying to do is create accessible, asynchronous videos and online material as well as a live group each month so that they can come and find their connections
Yes.
and the knowledge they need to advocate for their child and to take care of themselves. And
Yes.
this is called Parenting Kids with CHD. In case there's any listeners out there who have kids with congenital heart disease or pediatric heart disease or heart transplant, feel free to come and check it out.
Yes. And I can share links in the show notes for anybody who just wants to quickly get there. I think that's amazing. And I love that you're giving parents the option for both the asynchronous videos, but
Mhm,
also to be able to come and get some live support
mhm.
around that. I think that's so beautiful.
Yeah, I'm really looking forward to connecting. It's completely new. You can't do these kinds of things in healthcare, and it's my passion project. So I'm really excited to see it come to life. So thank you,
Yes.
Sarah.
Me too. Well, thank you so much, Dawn, for
You're
being here. I knew that
welcome.
I would love this conversation
Me
because
too.
it's been so nice to talk to you in the past. So thank you for sharing your
Thank
time.
you. Thank you so much, Sarah.
Thank you so much for joining me for this conversation today. If this episode resonated with you, I'd love for you to follow or subscribe to the Medical Trauma Support Podcast. It really helps more people find these stories and know that they're not alone. And if you're looking for a place to connect with others who understand what it's like to live with and heal from medical trauma, I invite you to check out the Befriend Your Body community. It's a supportive space where we explore somatic practices, nervous system education, and peer connection to help you feel safe in your body again. You can learn more and join us at medicaltraumasupport.com. Thank you for listening.